Good afternoon from HIMSS TV. We're here with Dr Sanji Silva, Vice President of Clinical Engagement and Clinical Informatics from Malaffi, based in Abu Dhabi. It's great to have you here. We understand you've been doing some great work with your health information exchange platform. Just give us a brief outline of how that work's gone and who you do it with.
Sure. Well, firstly, John, thank you for the opportunity for giving Malaffi the chance to talk about what we've been doing. Malaffi is the first health information exchange in the region. It was set up in a partnership with the Department of Health, our regulator, as part of their strategic initiatives to transform the way healthcare is being delivered in the Emirate of Abu Dhabi. And a key component of that strategy was to have digital enablement, and this is where Malaffi, the Health Information Exchange, was brought about. So we were launched in 2019 with a mandate to connect all licensed healthcare providers and facilities in the Emirate of Abu Dhabi. And I'm very happy to say that we are now connected 99.9% of those, and we have information from all encounters that take place in the Emirate of Abu Dhabi. So we have reached a success, I guess, very quickly. We're recognized globally as one of the fastest rolled out HIEs, and we continue to kind of build on the platform to deliver value to our clinician community, our regulator, and ultimately the patient themselves.
Has it been difficult getting the healthcare providers to buy into this concept, or was it mandated by the government? How did that work?
Absolutely. So we were, I guess, one of the reasons for our success was the government mandate. Yes, it was mandated that all healthcare providers have to connect to Malaffi. That certainly helped expedite the rollout process. There were very aggressive timelines that we had to meet, but we were also supported by a regulator in making sure that happened. But I think ultimately the buy-in from the providers and the patients themselves was also key. They were very excited about this. They could clearly see the benefits of having an HIE that broke down the information silos that I guess caused a lot of the issues around efficiencies in terms of the continuity of care process. So our physicians, our other clinicians are now using the HIE on a regular basis. They can see the benefits. It's having a positive impact on patient care. And the patients themselves, we've got many success stories where they talk about the benefit of not having to repeat information they've already given to another provider at a different facility, because now the clinician has access to that using Malaffi.
When I think about health information exchange and I see examples in other parts of the world, I often see health information exchange being relevant, sometimes with political boundaries, occasionally geographical boundaries, sometimes the boundaries that are bound by policy. But for me, it always seems most sensible to think about the natural patient flows. When patients are moving from primary care to secondary care, those are the times when it's perhaps most important to ensure the continuity of the record. What do you think about that?
I couldn't agree more. And that really was the premise on which Malaffi was founded, because what was happening prior to that was information was being captured at one facility and not shared. So a patient was being referred or they would turn up at an ED, and there was a paucity of information, so the clinicians were not able to make the decisions in a timely manner and didn't have enough information to make in some cases, the correct decision as well. So having that continuity of care from primary to secondary and then back again to primary has certainly been enabled a lot more by the access to Malaffi as an HIE. So having the right information at the right time in the right place is certainly something that has been key to our success, and has always been at the forefront of our mind when we've designed and implemented this solution.
Yeah, fantastic. And have you been able to elicit any feedback either from clinicians or indeed from patients?
Actually both. So we have a very robust approach to adoption. We have a team dedicated to making our physicians and our other clinicians aware of Malaffi as a HIE and the benefits of it. So we run regular weekly sessions with our providers in the market of Abu Dhabi, and we get a lot of good feedback from them in terms of how it's helping them, suggestions for improving it, increasing the data points, And similarly with our patients, we last year, in October last year, we released our patient app. So now patients have access to information that's captured from across the healthcare continuum in Abu Dhabi, not just from a single facility. And so to come back to your point, we are regularly engaged in the market, and one of our key initiatives in 2022 was our image exchange platform. And this was driven clinically by our physician end users who said, look, having access to radiology reports is great, but we actually want to see the images. And this really made us look into how we could implement a solution in a very aggressive manner. We're looking to connect over 60 PACS systems in the Emirate of Abu Dhabi by the end of 2023, and we'll have roughly around 2 million diagnostic images available to our physicians and other clinicians at the point of care.
And would that suggest that Abu Dhabi is moving towards a centralisation of the imaging services, or are you going to use HIE to continue with the disparate management of images within each healthcare provider?
Yeah, that's a good question. I mean, right now it's the latter. So we're really trying to again enable sharing of information, reducing the number of unnecessary duplicate investigations. So what was happening was patient would go from one facility to another. They'd have a repeat chest X-ray, or in some cases a more expensive diagnostic exam like a CT or an MRI. The patient was then having to wait for that repeat test to be interpreted and come back. So what we're trying to do now is to make the care delivery process more efficient, reduce the patient's unnecessary exposure to radiation, and ultimately improve the patient experience and outcomes. What we have also now done is by including imaging information along with other clinical biomarkers and other clinical data, we're now in a unique position to, I guess, future-proof ourselves for the implementation of AI and machine learning tools to help better delivery of care and predictive analytics and working more towards the preventative care model.
What are next steps? You've clearly done a fantastic job here, and it's an absolute credit to you and to the MOH, but where will the program go next?
Look, I think there are a lot of new strategic objectives coming out of not just the Department of Health, but we're also, as I mentioned, the changes in the way healthcare is being delivered globally is obviously impacting how things change within the region as well. We're constantly being driven by our physicians and other clinicians to improve the amount of data, the type of data that we're capturing. So we usually have a plan going forward for what we want to deliver each year. This year our main focus is completing our image exchange rollout, which we want to do by the end of 2023. As I mentioned, that gives us a unique opportunity to combine clinical imaging data and in the future genomic data as well, which now really enables us to support screening programs, disease registries and other preventative care measures that our Department of Public Health is looking to undertake. So really now our focus is to try and work closely with our regulator, the Department of Health, try and support some of their key initiatives, which is at the moment registry programs and screening programs. Look at how we can increase automating the way we capture data in a structured and standard format to then support those initiatives by feeding into registry platforms and helping them monitor screening programs and so on, really gearing towards more of a preventative healthcare model focused on primary care, preventative medicine, and then looking at how we can better coordinate and improve patient outcomes across the care continuum.
Sanji, it's been absolutely fantastic speaking with you. It sounds a fabulous program. Very well done.
Great, thank you very much, John. Appreciate it. Thanks.